Today, we are entering the most intense, transformative, and emotionally powerful phase of pregnancy, the third trimester, from week 28 until week 40. If you are in this stage right now, pause for a moment. Place your hand on your belly. You are carrying a nearly complete human being. From now until delivery, your baby will double in weight. Your body will prepare for labor. Your hormones will shift dramatically, and your emotions may feel stronger than ever. This is not just a physical journey anymore. This is preparation for birth. Let's walk through every week in deep medical detail, calmly and clearly. Section 1. What defines the third trimester? The third trimester officially begins at 28 weeks and ends at delivery, usually around 40 weeks. Medically, this phase focuses on 1. Rapid fetal weight gain. During the third trimester, your baby enters the most dramatic growth phase of pregnancy. From around 28 weeks onward, baby gains 1 or 2 pounds, 200 to 250 grams per week. Fat accumulates under the skin. Skin changes from wrinkled to smooth. Cheeks become fuller. Limbs become plumper. By 40 weeks, most babies weigh between 2.8 to 3.5 kilos, 6 to 8 pounds. Why this weight gain is so important? This is not just fat. It is energy reserve for afterbirth, temperature regulation, brain protection, organ support. The baby is preparing to survive outside the womb. Inside the womb, your baby is not just growing. Your baby is preparing for independence. 2. Lung maturation. Even though the lungs are formed earlier, they are not fully ready until late third trimester. What happens in the lungs? Production of surfactant increases. Air sacs, alveoli, mature. Breathing movements become rhythmic. Baby practices breathing, amniotic fluid. Surfactant prevents lung collapse after birth. Without enough surfactant, breathing distress can occur in premature babies. By 34 to 36 weeks, most babies have adequate lung maturity. By 37 to 40 weeks, lungs are usually fully ready. This is why full-term delivery matters so much. 3. Brain expansion. This is one of the most incredible processes happening. During the last trimester, brain size increases significantly. Neural connections multiply rapidly. Brain surface develops more folds, gyri and sulci. Memory and sensory pathways mature. At 28 weeks, the brain is still relatively smooth. By 40 weeks, it becomes deeply folded, allowing more surface area and higher function. What is developing? Sleep cycles, response to sound, recognition of mother's voice, early learning ability. Your baby is already listening, already learning, already forming connections that will shape their future. 4. Immune system preparation. In the third trimester, something beautiful happens between mother and baby. Through the placenta, mother passes IgG antibodies to the baby. This gives the newborn temporary immunity. This protection helps fight respiratory infections, certain bacterial infections, some viral illnesses. This transfer is strongest in the last 4 to 6 weeks. That's why preterm babies may have weaker immunity at birth. Breastfeeding after delivery continues this immune protection. 5. Maternal physiologic adaptation. While baby prepares for life outside, mother's body prepares for birth. Cardiovascular changes. Blood volume increases by 40 to 50%. Heart works harder. Mild shortness of breath may occur. Respiratory changes. Diaphragm pushed upward. Increased breathing effort. Gastrointestinal changes. Heartburn increases. Slower digestion. Musculoskeletal changes. Back pain. Pelvic pressure. Joint loosening due to relaxing hormone. The mother's body becomes softer, more flexible, and birth ready. Your body is not weak. It is transforming. Every discomfort has a purpose. 6. Cervical preparation for labor. As the due date approaches, the cervix begins to change quietly. This process includes softening, ripening. Cervix becomes softer due to prostaglandins. Effacement. Cervix thins out from 3-4 cm long to paper thin. Dienschuniscement. Dilation. Cervix begins to open, 0 to 10 cm. Loss of mucus plug may appear as thick discharge or bloody show. These changes may start weeks before actual labor. Braxton Hicks contractions also help prepare the cervix. In the final weeks of pregnancy, nothing is random. Every cell is working with purpose. Your baby is gaining strength. Your body is preparing for birth. And together, you are approaching one of the most powerful moments of life. The baby is viable outside the womb after 28 weeks, but still premature. Every week inside the uterus now significantly improves survival and reduces complications. That's why weeks 28-40 is so important. Section 2. Baby development week by week. Weeks 28-30. Average weight 1 to 1.3 kilos. Length around 37 to 40 centimeters. Brain development. Rapid formation of neural connections. Brain surface develops gyri and sulci, folds. Increased sensory processing. Eyes. Baby can open eyes. Retina becomes light sensitive. Baby responds to bright light through abdomen. Lungs. Surfactant production increases. Surfactant is crucial. It prevents lung collapse after birth. Movement. You will feel strong kicks, stretching, rolling, hiccups. Kick counts become important now. Normal, at least 10 movements in 2 hours when baby is active. Weeks 31 to 34. Weight 1.8 to 2.3 kilos. Fat accumulation. Baby begins storing subcutaneous fat. Skin becomes less wrinkled. Immune system. Antibodies from mother pass to baby through placenta. Positioning. Most babies begin turning head down, cephalic position. If baby remains breech after 34 weeks, doctor may monitor closely. Bone development. Bones harden, but skull remains soft to allow passage through birth canal. Weeks 35-37. Weight 2.5 to 3 kilo. Baby is now early term. Lungs nearly fully mature. Digestive system ready to process breast milk. Sleep cycles. Baby develops REM sleep. Movements may feel less frequent, not because baby is weak, but because space is limited. Still, movements should remain consistent daily. Weeks 38-40. Baby is full term at 39 weeks. At this stage, organs are fully developed. Lungs are ready. Reflexes, sucking, grasping, are active. Baby is simply waiting for labor signals. The body releases hormonal signals that initiate labor. Increased oxytocin, increased prostaglandins, cervical ripening. Birth can happen anytime. Section 3. What happens to the mother's body? The maternal body undergoes massive adaptation. 1. Uterus expansion. By 40 weeks, uterus expands from pelvic organ to rib cage level. Weight increases from 70 grams to nearly 1 kilogram. This causes rib pressure, shortness of breath, heartburn. 2. Cardiovascular changes. Blood volume increases by 40-50%. Heart works harder. Possible symptoms: palpitations, mild swelling, low blood pressure when lying flat. Important: always lie on your left side to improve circulation. 3. Edema, swelling. Common in feet, ankles, hands. Normal swelling is gradual. Danger sign: sudden facial swelling plus headache, possible preeclampsia. 4. Back and pelvic pain. Hormone relaxin loosens ligaments. Pelvis prepares for birth. You may feel pelvic pressure, sciatic nerve pain, prearterdiome, masitruntas in lower backache. Support belt and gentle stretching can help. 5. Braxton Hicks contractions. Practice contractions. Characteristics: irregular, mild. Do not increase in intensity. Stop with rest or hydration. They are not real labor. Section 4. Nutrition in third trimester. Baby gains most weight now. Daily needs: 70-100 grams protein, 2,000 milligram calcium, 27 milligram iron. DHA for brain development. Recommended foods: eggs, lentils, chicken, fish, low mercury, yogurt, spinach, almonds, dates. Hydration: 2.5 to 3 liters water daily. Avoid excess salt, sugary drinks, processed foods, raw meat. Iron deficiency is very common in this stage. Test hemoglobin regularly. Section 5. Warning signs. Critical. Seek immediate medical attention if you experience heavy vaginal bleeding, severe persistent abdominal pain, severe headache with blurred vision, sudden swelling of face or hands, no baby movement, high fever, fluid leakage before 37 weeks. These may indicate placental abruption, preeclampsia, preterm labor, infection, Ruptured membranes. Never ignore these symptoms. Section 6. Signs of true labor. True labor contractions. Regular pattern. Increase in intensity. Closer together. Pain radiates to back. Do not stop with rest. Time contractions. If 5 minutes apart for 1 hour, go to hospital. Other signs. Bloody show. Water breaking, clear fluid gush or trickle. Pelvic pressure. Lower back pain. Section 7. Delivery options. 1. Vaginal delivery, normal labor. Vaginal delivery is the natural progression of childbirth, where the baby is born through the birth canal. It happens in 3 main stages. Stage 1. Cervical dilation, 0 to 10 centimeters. This is the longest stage of labor. The cervix must open from closed, 0 centimeters, to fully dilated, 10 cm. Early labor, 0-3 cm. Mild irregular contractions, back pain. Mucus plug may pass. Mother can still talk and walk. This phase may last hours, sometimes even a day, in first-time mothers. Active labor, 4 to 70. Contractions stronger and regular. Occur every 3 to 5 minutes. More intense pressure. Transition phase, 8 to 10 cm. Strongest contractions, shaking, nausea, emotional overwhelm possible. Very intense, but shortest part. Every contraction is not pain without meaning. It is the door opening for your baby. Stage 2, pushing. Stage. Once fully dilated, 10 cm. Mother begins pushing. Baby descends through pelvis. Head crowns, visible at vaginal opening. This stage may last 20 minutes to 2 hours. Longer in first pregnancies. The baby rotates to fit through the pelvis. When the head delivers, shoulders follow. Then the body slides out. This is the moment of birth. Stage 3, placenta delivery. After baby is born. Mild contractions continue. Placenta separates from uterine wall. Delivered within 5 to 30 minutes. Doctors check. Placenta completeness. Uterine contraction. Bleeding control. This stage is shorter but medically important. 2. Assisted vaginal delivery. Sometimes labor needs help. Assistance is considered when mother is exhausted. Baby is not descending properly. Fetal heart rate concerns appear. 2 main tools. Forceps, metal instrument shaped like large spoons, placed around baby's head to guide delivery. Vacuum ventouse, soft suction cup placed on baby's head. Gentle traction during contractions. These are used only when necessary and performed by trained professionals. Assisted delivery does not mean failure. It means safe decision-making for mother and baby. 3. Cesarean section, C-section, a surgical delivery through an abdominal and uterine incision. It may be planned, elective, or emergency. Common indications. 1. Fetal distress. Abnormal fetal heart rate indicating baby may not be tolerating labor. 2. Breech presentation. Baby positioned feet or buttocks first instead of head down. 3. Placenta previa. Placenta covers the cervix, blocking vaginal delivery. 4. Failure to progress. Labor does not advance despite adequate contractions. Other possible reasons. Previous C-section, in some cases. Large baby, macrosomia. Maternal medical conditions. What happens during a C-section? Usually performed under spinal anesthesia. Mother awake but numb from chest down. Baby delivered within 5 to 10 minutes. Entire procedure lasts about 30-45 minutes. Recovery is longer than vaginal birth, but often very safe. Whether your baby enters the world through the birth canal or through surgery, the goal is the same: a healthy mother and a healthy child. Birth is not about how the baby comes. It is about the moment a mother hears that first cry. Vaginal delivery, assisted delivery, or cesarean section. Every birth story is powerful. There is no failure in C-section. Safe mother and baby are success. As Section 8, emotional transformation. The 3rd trimester is emotionally intense. Common feelings: fear of pain, anxiety about baby's health, doubt about motherhood, overthinking at night. Let me tell you something gently. Every mother feels this. Courage is not absence of fear. It is moving forward despite fear. Short emotional story. At 39 weeks, Maria couldn't sleep. She was afraid of labor pain. Her mother told her, "You were born the same way. Your body already knows what to do." That night, she stopped fighting fear. She trusted her body. 2 days later, she held her baby. Sometimes strength is simply trusting nature. Section 9. Preparing for birth. Prepare hospital bag at 36 weeks. Include ID and reports, comfortable gown, baby clothes, pads, toiletries, phone charger. No. Cybery. Hospital route, emergency contact, doctor's number, discuss birth plan, pain relief options, support person, skin-to-skin contact, breastfeeding plan. Section 10, after delivery. Immediately after birth, baby placed on chest, cord clamped. APGAR score assessed. Breastfeeding within 1 hour is ideal. Colostrum, thick yellow milk, rich in antibodies, protects newborn. Mother may feel emotional, exhausted, overwhelmed. This is normal hormonal adjustment. Final message. If you are 28 weeks, take care of yourself. If you are 34 weeks, stay consistent with checkups. If you are 38 weeks, stay calm, stay ready. If you are 40 weeks, your body is wise. Birth is not just a medical event. It is transformation. You are not just delivering a baby. You are becoming a mother. If this video gave you clarity and confidence, share it with another expecting mother, comment your week of pregnancy below, and subscribe for more trusted medical guidance. You are strong. You are capable, and you are almost there.